Both dentists and hygienists have opportunities to counsel patients about oral health-related behaviors. As a dental professional, you have a responsibility to talk to your patients about tobacco use and how it affects their oral health. However, it is important to keep in mind that the way you approach your patients about this issue will have a big impact on how your advice and concerns are received. In general, it is not useful to confront or lecture your patients about their tobacco habits, as this approach is usually not well received by patients and may interfere with your ability to counsel them effectively. Watch what happens as this provider becomes more and more confrontational in her warnings about tobacco use and her advice to quit smoking.
Okay, so I finished the exam. Have some good news and I have some not so good news. Looks like you don't have any cavities, so that's the good news.
That's great.
However, I'm pretty concerned about something I'm noticing in your mouth. Actually, if you look up here, the roof of your mouth, I'm noticing a lot of irritation that's really consistent with tobacco use. And you had said on your form that you're not a tobacco user, so I'm just wondering what's going on.
I don't smoke cigarettes.
Okay. Well, as I said, there's a lot of irritation. In particular, like I was mentioning, up here in the roof of your mouth, it's turned really deathly white colored and there's little red spots. And you probably didn't notice because we don't spend a lot of time looking at the roof of our mouth. But you're really damaging this tissue in your mouth, which can really cause some severe problems in terms of your oral health. It's called nicotinic stomatitis, and this is something we don't see in any patients who don't use tobacco. So maybe you're not smoking cigarettes. Are you smoking a pipe or cigars, or is there something else that could be contributing to this? Because I don't know what else might be causing it.
Well, the only thing, I've never smoked cigarettes, ever. But when I go out with my friends, we like to go to, we like to go out to lounges and sometimes there are those nice young men that gift you different sorts of things, and we got some of those mini cigars, Swisher Sweets. They come in peach and grape, and that's the only time that really I've ever really used anything that's got tobacco in it.
Okay, so I think that's a pretty common misconception because they're fruit flavored. People think they're okay. Those are really bad for you. Did you know that?
Really bad, but they're just little cute little girly cigars.
Right, they're still cigars and they're still tobacco, and so they still cause lung cancer, oral cancer, emphysema, all those same kinds of things that you would see with cigarettes.
Well, I only
really
use them
important.
just to relax. I mean, it's not like it's something that I would smoke 20 or 30 cigarettes a day. I mean, I only do it when we go out.
Well, at least you're not doing that, so that's good. But it's still causing a lot of problems, and as I said, I can see the evidence in the roof of your mouth. You're causing some serious damage, and this needs to stop. Have you thought about quitting?
Well, I didn't really know I'd started.
What do you mean?
I didn't really think that it was anything more than just like social drinking. Just something that I do in a social setting when me and my friends go out to the bars.
So you're gonna quit then?
Maybe.
What do you mean maybe? I just told you how bad it is for you. It's messing up your mouth. You're putting yourself at risk for all these other diseases. This is really important. You need to quit.
Well, it's something that I'll have to think about.
What's there to think about? You said it's not something you do all that often. There's all these negative side effects. There's all these risks that you're putting yourself in.
Well, it's just something that I do to relax, and I don't do it that often, and so I probably could cut back.
Okay, well that's a good start, but cutting back isn't going to do it. If you actually quit the smoking, you can reverse all the damage you've done in your mouth, and you can stop yourself from being at risk for these other diseases. But as long as you're continuing to use these cigars, you're really putting yourself in a lot of danger.
Well, I don't believe that they're cigars. And what I do believe is that it's a choice, and it's my right, and it's something that I choose to do. And so I will think about cutting back, but I'm not at a point where I'm ready to do that. And I'm not really sure that I even believe that what you're telling me is real.
You're choosing to really damage your mouth, and actually it can cause problems with your teeth too. I don't know if you notice your teeth might be getting yellower than they were before. That's another side effect. There are a lot of really negative things that go along with any tobacco use, whether it's cigarettes, cigars, dip, chew, snuff, snooze, hookah, any of it. This is a really important decision that you're making, and you said it's your choice, but you're really choosing to make yourself sick and potentially die.
Well, it's something that I'll think about.
Well, I appreciate you thinking about it. I hope you'll think about it really hard. You know, this is something that I'm going to continue to ask you about because it's something that really needs to change.
As you can see, the more the provider pushed the patient to quit smoking, the more withdrawn the patient became. What might have been a good example of comprehensive oral health counseling quickly turned into a power struggle, with the provider growing more frustrated and the patient becoming defensive and asserting her right to continue smoking. Too often, we try to talk our patients into changing their ways by giving them a lot of information about the risks associated with their behaviors. This usually is not a successful approach because we are generally not able to engage the patient in a fruitful discussion this way. Instead, we should focus on eliciting our patient's own personal reasons for change.